Yo, what's up, everyone? Welcome back to another episode of Unfucking Your CX. I'm your host. Everyone knows that. You don't really give a shit. What you care about is who's in the hot seat today, what's making them cringe, and what are their player tips. And I'm really excited for today's guest because we've had an inner circle together that we didn't know about until right before the call. But Brett, you are a true and true practitioner, always kind of being in industry from, kind of healthcare, insurance, this retail piece. Welcome to the
Yeah, thanks a lot for having me. I've been a big fan of your LinkedIn post for a long time, as you know. I'm very happy to be here.
I will say you're probably the most well-dressed guest I've had in the hot seat. So
Nice.
you win that trophy for today's conversation. But
Take it.
Brett, we know these types of conversations as CX practitioners, they don't just happen, right? Typically they come up organic when we're kind of in safe spaces. So I'm curious, set the scene for us and our listeners. Is this happening in your favorite pub, maybe a restaurant? Are we where's this going to take place?
Yeah. I led patient experience in the healthcare system for the last 4 years. So I lived and breathed in this world. And I think my example actually takes place in the corporate office when we're making decisions. The situation that I bring up that's messed up because we have all this data, all these surveys that we do in real time. We survey our patients, we get a fraction of them tell us how we're doing, and then we're making these long-term decisions on what people are telling us now and information we've had over the last year, but not making those decisions based on what's going to happen in the future.
Yeah, I think that's such an important topic that's got you cringing that you really want to unfuck. And I think part of this, I just shared with you, I was just on this call with a client, and if you look at kind of their day-to-day strategy, like incredible, right? Impeccable kind of day-to-day strategy with surveys, interloop. But when you think about how well is their experience strategy wrapped around kind of that 2, 3, 4 year strategic vision of the company, it falls so flat. Brett, why do you think that is? Like, why do you think practitioners are just so short term, narrow focused?
I think part of it has to do with the data that they have. So what do? We send an email survey, we send a text message, you get a prompt, and that's the information we have right at this exact moment. If there's a complaint, let's drop everything and solve the complaint. It's fires, it's putting out fires in the moment, it's what's going on now. And we don't take a moment to step back and think, okay, so let's think about this now, a month down the road, a year down the road. What are our competitors doing? What is our actual business strategy? And how does experience fit into that? What do we want that experience to be in a year? And I'll tell you the one thing that's so messed up, Zach, is we're in July. People probably already have all their budgets spent for IT and everything. They're probably spending it already for next year where it's going to be allocated. But did they really think of what's that patient experience going to be like? What's the customer experience going to be like a year from now? And are we investing in the right areas?
Yeah, I think that's such an important moment to kind of spend on for a minute, right? Because if you think about these strategic visions that our executive leadership team set, right, from the CEO down, if you're a publicly traded company, as a CEO, she's selling investors on what this vision is. He's selling shareholders like this is what we're going to be in 3 to 5 years. And ultimately, when we become this, it's going to maximize your shareholder value, right? If you are
Mhm.
a privately traded company, it's the same thing. You have investors, they're, sharing with their board and the investors. And in my experience, very few of those 3 to 5 year strategic initiatives fail. I'm sorry, very few of them succeed. Most of them fail. Now I get it.
Yeah, that's just
Sometimes
one. Yeah.
you have to react to the what's happening globally and macroeconomically and tariffs and all these things that have been happening the last couple of years. But I think it ties back to your point. Most of the time they fail because there's no experience strategy
Yeah.
wrapped around it.
Yeah, I agree. And there's so much that information that we have now that we didn't have 5 years ago, 10 years ago. I mean, just the adoption of AI everywhere. But you can take all of the data that you have, social media, the patient customer data that you have right now, your competitor data, you can put it all in. And you can have a pretty good predictive model of what it's going to look like 6 months down the road, a year from now. I think we're stuck in the moment too much and need to use that.
Yeah, I think it's absolutely. I think it comes back to what does your signal architecture look like or
Mm.
data architecture look like from a CX perspective, right? And I encountered this when I was at Aaron's, where we were building a like the building CDPs was a big initiative for every company back in the day, right? CDP was hot. And so ultimately I got hit with, well, we're building this CDP. Why is it important that we have all this customer data in your VOC platform? Like help us understand it. And I tried to just sell it as, well, it's going to give us a total 360 view of our customer. And they're like, great. This initiative we're working on with the CDP is costing us millions of dollars. Like your 360 view can come later. And that later never came. And
Yeah.
so I realized in order to make the business case, Brett, of why I should bring all those customer signals together that you just mentioned, was it wasn't about the customer experience dashboard. It was on how every kind of team has their own kind of story of the customer and how many of us got hit every month or quarter with this new kind of customer issue that popped up and now
Hmm.
exposed us to financial risk or it hit our P&L 2 to $3 million, right? Like, and we're like, holy shit, if we just brought all of our signals together, we would have uncovered that.
Yeah. Yeah. And what do? We add more money to our service team or complaint department or escalations department, build those up. Hey, complaints are going to go up, so we need to add more people. If we would reinvest that money into solving those problems at the core, then it's a win-win across the board.
Yeah, and I think the other piece too, to thinking a little bit more strategic, you mentioned it a little bit earlier on. I think this is your second player tip is just how does the organization work? Right? So you mentioned, really understanding the system in which they work in. And so many strategic, I think, initiatives fail because they're so slow. They adopt that old waterfall
Yeah.
approach. And you mentioned more of this kind of agile mindset. Talk to us a little bit about that.
Yeah. Well, a perfect example. I mean, the company that I'm at right now, like we live and breathe for the client. That's our customer experience right there. And what's interesting, you had a post about this previously about where's your money going? Like you have all this talk in the world about the best customer experience, but all the money then goes to cost reduction strategies or whoever knows what else. And you can see that's a very good litmus test right there. Where's that money being spent? And do you actually put your money where your mouth is? I think that for companies that are actually investing in customer experience, there is a cost now, but the return, especially over the next 6 months, is going to be huge.
Yeah, I think it kind of goes back to what you were saying. Where's your company at now? Where is it going? So if you think about, depending on where your organization is, you might be firefighting, right? So your CEO might be fighting quarter to quarter just to keep his job or keep her job,
Yeah.
right? Depending on where you're at. And so they may only be looking at strategic initiatives that are going to deliver something in this specific quarter or maybe next quarter, right? Where you might have other organizations like you're working with in healthcare, they're not really living and dying quarter to quarter.
Right.
I should say the CEO. They're looking at how do we provide better healthcare over the next 12, 18, 24 months, 3 years, 5 years, right? So it's more strategic. I'm curious, how do you balance that short term, long term? Because you haven't always played the long term game. I think you've been in
No.
some short term games. So how do you balance this?
Yeah, for sure. Well, I think it's important to have that long-term plan, and a lot of people don't. You've had clients you've talked to. I've had clients I've talked to. Let me see your long-term plan. And it's like next year. It's not really a long-term plan. Like, where do you want to be in 5 years? Where do you want to be in 10 years? Where do you want to be in 20 years? What's the vision for this company? And then the short-term benchmarks and steps to get to that point. If you think long-term is 1 year down the road, then you're missing out on so much opportunity.
Yeah, and that even kinda tells you where the state of the organization's at,
Right.
right? And I think part
Yeah.
of this is CX practitioners is, are we matching our own kind of skill sets and desires with and goals with where that current company is at?
Yeah, yeah, that's a good point. And it really you're so true about the culture of the company. Because when you have everybody in that company living and breathing for the customer, for the patient, then that's where the money's invested. That's where people are looking for solutions. If you don't, if you have people with their own competing priorities and their own silos and their own responsibilities that don't really care about the end user, it's just this downward spiral they're going through.
Yeah, yeah, I mean, look, for me, I love the firefighting, like, I love getting into broken strategies, kind of broken companies, and kind of rebuilding from the ashes. Like, I just thrive on that. Most people don't. Where are you at? Are you at the, "I like to rebuild from the ashes," or, "I like to build for 5 years from now"? Where are you at on the spectrum?
That's a really good one. Now, when I think of firefighting, by the way, I think of the executive complaint that's coming in right now. Let's drop everything and go solve it. Like that is not, I spent a lot of time doing that. And it's not where you really grow your business, really growing that from the ashes. This thing's broken. Our competitors are beating us. We're losing market share. Then really bringing in this high level plan and then all the detailed actions and all the tools that are available to do that. That you're right. That is very exciting to do.
If you think about kind of that third player tip, so you've talked a little bit about one, the signal piece, right? Stop relying on surveys, bring all your data together, all your signals together. Second one was really kind of around understanding that strategy, that strategic vision. Where are we at?
Mhm.
What would you say is the third player tip?
So the third player tip I would have, I would look at the onboarding process to your company. And here's a very eye-opening thing. You go to talk to that first person who's just hired, just pick up the phone, call somebody that was hired 30 days ago and ask them what their top 3 priorities are. It's going to tell you right there how ingrained the culture is of the customer, taking care of the customer. No matter what I have to do, I have to take care of this customer. Or is it going to be, I have to make sure I punch in on time, punch out on time. I have to make sure that I do my reports on time. I think that is a pro tip right there that has served me very well. And also thinking of myself as a leader when I led this, is my message cascading down? Or at some point, is somebody reintroducing their own priorities? And now that person that's actually the one interacting with the customer, they're misaligned to what my vision is.
It's really interesting, right? Because every organization, there's always kind of that middle management layer.
Hmm.
And they are the most important layer in almost any company. Of course, your companies can't run if you don't have kind of your frontline teams, right? So in healthcare, your nurses, your doctors, your healthcare team. But that middle management is responsible for cascading that top down kind of messaging. And even if your company is great at internal communications and messaging a broad message, then that middle layer still has to say, okay, well, how is that relevant to you and your specific role?
Yeah.
And Brett, I've worked with so many companies where the middle layer is the bottleneck. So
Yeah.
how do you team up with the middle layer as a CX practitioner to solve that?
Yeah. So here's a good example. Look at their annual review and look at how their annual review is scored. How do you get your bonus? Almost always it's heavily weighted on profitability or expense reduction or KPIs. And very rarely is it weighted on our customer retention and services like that. And if you have this alignment from this day you start till you review and all these checkpoints along the way, everybody's aligned that, hey, I take care of this customer no matter what. I'm going to make sure that they're happy, that they're retained, that they're loyal to us. That is a secret sauce that very often is missed because the numbers are just easier to track in some way.
Yeah, I love how you pointed out, like, ultimately, even on the front line, how am I responsible for customer retention or patient retention, right? Because especially now in the States with healthcare being deregulated, it's so
Mm,
competitive, right?
yeah,
I think you bring up that important piece of what is their performance metrics? Is it
yeah,
just an NPS score or is it I'm responsible for customer retention? I'm responsible for customer loyalty. I love how you bring that up. So often, most companies don't have that. So, how do you work top, at the top to influence why the outcome metrics should be included for everyone in the organization?
Yeah, this is a great example because this happens a lot. How do you influence at the top to get it across the organization? Okay, flip it around and help the people at the top understand what's going on with the patient. And there's two things that really worked out well. And I do this with a lot of clients now. First one is you pick up the phone and pretend that you are a customer. You're calling in, you're going to a store, secret shop kind of thing, but do it with them and really understand, wow, I'm on hold for a long time. I'm transferred many times. Why do we do this prompt like this? This is really weird. Amazingly, they haven't done that. We're making big decisions, but we don't really understand currently where we're at. And the second thing is having the employees having this feedback loop where, we cascade things down, we cascade things up, it gets filtered, it gets watered down. There needs to be a way where you can have from the frontline people, hey, this is a bottleneck, and it goes to the person that can actually make a decision to remove that bottleneck. And having that kind of two-way dialogue, patient family advisory councils, if you're involving patients, or customer or employee feedback loops, whatever you're going to call it. But these best ideas come from those closest to the customer.
Yeah, I love that. And I also love just that kind of bonus tip of you can't really empathize with your customers or patients unless you go through their exact same journeys. And
Yeah.
it just flagged me. I remember when IVR was first coming out and we were embedding IVR into the Aaron's home support center, home solution center, sorry, which is what we called it. We were bragging about the FTE expense that we were saving. What we weren't paying attention to was customers that we were pissing off that weren't coming back because it was
Yeah.
so hard to get support from us. And I'll never forget when we were sitting kind of in this executive table, I asked how many of the executives, like, if you had to call into a contact center to get a bill resolved, how many of you were doing it? Or how many of you have people doing it for you?
Yeah.
And most of it was, well, if I can't do it on the app, then I'm not doing it. Probably my spouse or my partner takes care of it. And so in that moment, I just kind of picked up and I had our CEO call the home solution center and interact with the IVR system.
Yeah.
And he's like, I literally had to press 7 buttons to get connected to someone 2.5 minutes later. And I was like, yeah, but guess what? Guess how much FTE we saved?
Yeah. Right.
And
Right.
in that moment, he was just like, okay, we've got to see how much has this impacted kind of customer lifetime value. What ended up happening is we hired almost double the staff back because it was so bad.
Yeah, absolutely. And there's an ROI attached to the cost savings up front, but then that customer loss. We spend a lot of money trying to get customers in, but boy, if we would invest in retaining them and having a great experience.
It'd be significantly different, right? The businesses would look completely different. You're so spot on there. Well, Brett, we could continue this conversation. I know the seat's getting hot, and if any of our listeners want to go deeper into how you're solving this in healthcare as a practitioner, where can they find you?
Yeah, I'm on LinkedIn, Brett Kiley. My company is Cyclum, and yeah, I'm easy to find and happy to meet up and help out in any way.
Well, Brett, thanks so much for coming onto the show, Into the Hot Seat. Don't be a stranger. Come back, and
Yeah.
we'll speak soon.
Thank you, Zach.
Cheers,
Appreciate
bud.
it.